issue for them. Most recent published article, it says stem cell has 91% success rate and improvement for up to 12 months. This is huge after only one injection. And now some doctors and insurance companies, they say stem cell therapy is unproven, it's expensive. I'll tell you who says and what kind of people they say it's expensive and it's unproven in a minute. But these are the same people, they say other type of natural treatment is unproven because there is no money for pharmaceutical companies or the doctors. I want you to Google cost for back surgery. Every year there is over 500,000 back surgeries, over 500,000 neck surgeries, 720,000 knee replacements. The surgical industry is a billion-dollar industry, and surgeons are the ones who are saying stem cell is unproven and expensive. And they say about everything else but surgery. This is directly from Google. You can Google it yourself. When combined with magnetic resonance imaging, MRI, rehabilitation and disability, the average spine surgery approaches 100,000 or more. Follow this. The direct costs are astronomical and may reach up to 169,000 for lumbar surgery, which is the low back, and 112,000 for cervical fusion, which is neck. I don't want you to get me wrong. I have many physicians and physicians' family members as our patients. These people, they tell me I will never have anyone cut me for a surgery. Did you hear that? Physicians and physicians' family members tell I will never have anyone cut me for surgery. When a physician doesn't want to be cut, do you really think it is a good idea for you? At the cost of multiple surgeries, out-of-pocket expense, and the toll that surgery takes on your body, that's effective, but stem cell therapy is not? Why not give a stem cell therapy a try? I want you to understand, I'm not against surgery. Don't get me wrong. There are cases that surgery may be necessary. I have a lot of respect for my colleagues, my surgeons that I know, for helping people every day in and out, for putting their lives and work 10, 15-hour days to perform surgeries and change people's lives. However, as I have said before, surgeons are trained when the patient may need surgery, but they need to get trained or retrained when surgery may not be necessary, and stop quickly making a decision for a steroid injection or therapies with a lot of side effects. This is insane. Richard Deo, he's a medical physician at the Oregon Health and Science University. He notes, this is not what I'm saying, this is what he is saying. It is outrageous that the number of patients with the most complex spinal pathology has increased 15-fold during the past 6 years, and mentions one reason for this substantial increase is not the people that have changed. It is the strong motivation of surgeons and hospitals due to financial incentives to perform and get paid for surgical services. Did you hear that? In other words, People now versus 10 years ago versus 20 years ago, they're the same people. But there's a lot more surgeries performed. It could be because surgeries make money for hospitals, make money for surgeons. I'm talking in general. I'm not saying you shouldn't have surgery. Many times surgeries are successful, but many times surgeries are not successful. And if they are not successful, that will create a problem. We went through all of that for nothing, for no reason. You may need another surgery after the first one because it was not successful. I'm not sure if you have heard the condition called failed back surgery syndrome. It is so prevalent that in the book of all diagnoses that the doctors get, there is a code for it. The diagnosis, it's called failed back surgery syndrome. It's considered a condition. This is crazy. Richard Deo in 1990s, I think 1994, it compared international rates of back surgery and discovered the rate of surgery in the United States was at least 40% higher than any other country in the world. And the number of surgeries in the United States was more than 5 times than the surgeries that are done in England or Scotland. So this is all education for you. The cost of knee surgery or shoulder replacement surgery is over $80,000. And they only have 50% success rate. Don't believe me? Google it. It has 50% success rate, 50% failure rate. And these surgeons and pharmaceutical companies are the ones that claim stem cell injection is unproven, expensive, because we keep people out of surgery, because they cannot patent natural products. That's the type of studies they do. Pharmaceutical companies cannot patent natural products. This is one of the biggest problem with regulations and the laws, because there is no money for them to regulate natural products. The cost of stem cell injections and stem cell therapy is a fraction, little percentage of what it costs to have back surgery. Stem cell therapy is effective in place of back surgery, and it has found to have effect with only one injection that will reduce and eliminate your pain most likely. What are you waiting for? Can I guarantee it? Absolutely not. Are we successful? Yes, very successful.